This lecture we are talking about role of a government in health. But here what is coming? What role of a government? But in the cases of health. Okay. So in the other words, we also can say about health. Okay, about health. What are doing our government? Okay, about health related to health. So what are condition in our India uh, through health. So in this lecture, we are going talking about role of government, but in the condition of health. What are situation, what are condition in our country, and I would say about health, about health. Okay, about health, about related to this issue, related to this issue only does not comes in our India, also comes in our in the world. Okay. So what I am telling you, I am saying you about related to health. Sometimes suppose related to health, arrest issue. Okay. But what I am telling you related to health, whenever whenever arrange issue related to health uh, in the world, then we can say at global level. Okay. So perhaps maybe related to health, we are going talking about only in the cases of our country. Okay. So we will see. Okay. So what is health? Here question is what is health and what is meaning of health, and health, about health word you already have heard. Okay, have heard. But in this case, what will be meaning of health in this matter? In this matter, what will be meaning of health? And here are defined. Here are given definition of health. But in your word, how you say what is health? What is meaning? What means health in your word? And often in your daily life, you realize feeling health in your life, you realize related to health. Suppose you are sick, then you are not fit. So it's coming what health. How is your health fitness? Okay, how are your health fitness? And you are telling doctor, doctor, I am sick suddenly. So you take me, you see me, what happened? And the doctor and the doctor say, look, whenever you eat junk food, then sometimes it happens. Okay, sometimes it happens means I am saying you, whenever you eat junk food, related to food, junk food, then you suddenly you will sick, you will fever. So I give suggest you, but you don't eat junk food, you eat only fast food, diet. In other words, we can say diet. So here we are talking about what? Health. What are situation? Whenever you are sick, ill, okay, fever, any kinds of a disease, then we we will now what? We are sick means I am not fit in health matter. Okay, and I just said, but if you consult the doctor, then doctor says you are not fit in your health sector, in your health services, means you are eating junk food, then how can you how can you maintain your life, maintain your health? Without health, cannot live your life. Okay, so in this world, we already say in our society. Okay, and when you study in your school, in your college, and in your home, when topic comes health, then in your book will read, will write what about health, what is health, how we can survive in better situation in the matter of health. Okay, in matter of health, how we can live in better situation. Okay, so what I am telling you about related to health, we multiples see, we see multiple times. So here are given definition, but will be different. Okay, so let's see. Health means our ability to remain free of illness and injuries. Here you are saying what illness and injurious. These tells us these show as what you are not suitable, okay, in your health services. And here are saying health means our ability, capacity to remain of favor. Injurious means when your body cut, when you fall, when you travel. Okay, when your body, part of your body means hand sometimes in any matter, your body, your part of your body and cut. Okay, then you realize what injurious. Okay, injurious and illness means fever, sick. Okay, then we can say you are not health. Okay, you are not healthy. So and also this word, this sentence, you are saying what our ability, how is our ability, capacity to remain free of illness and injuries. And okay, we will move, but it's our first word, so it's compulsory to understand. Okay, apart from means disease means it's a types of illness, types of injurious, types of sick, fever. So maybe many types, and we will see in the next term what are many kinds of disease. Okay, but here are saying apart from disease, there are other factors that affect on our life, on our health, that affect our health, such as dullness, inactiveness means lazy. When you lazy, then you will realize what I am not working in better condition. So then in short word, you can say what inactiveness, and it is what it's types of disease in the other word. Okay. So dullness, but here are saying also what apart from disease, then we are talking. Then I am telling you what apart from disease, there are other factors that affect our health, such as dullness, inactiveness, In other word, meaning of inactivity is lazy. Anxiety, anxiety. Uh, when you think I am not reading and I am not reading and my syllabus is incomplete and my exam is coming near, then how how can I pass in my exam? Then comes anxiety. Okay, so any types of what reason to come anxiety or being a scared. A scared means being a scared. Here I'm not saying only a scared, as being a scared for a long time. Then what happens? If we are in situation being scared, then what will happen? Okay, we will see. Then what happens? But here a scared word meanings. What means of a scared, and I take an example of your example. I take an example. You will see often what you will see often in your family. Your parents scold. Your parents scold you. Then entire your body comes fear, comes scared. Okay. Then your parents scold you. Okay, clear? It's clear. But here I'm not saying when your parents scold you, then comes a scared note. Here I'm saying, oh, then comes also a scared, but here it's a sentence, not here are saying. Being a scared, okay, for a long time. Then comes disease, okay, a scared for a long time. And these are you are saying what according to this, due to this, our body, this affect on our body, on our health. Then we will face what kinds of this disease. Okay. So for long time, what being a scared and being anxiety and being activeness for long time, then comes then can impact on our body. And diaspora. About diaspora, do you know? Before that, do you know? Huh? Was you know? Diaspora is a waterborne disease, and through water word, you will know, you would know, but means this may be this is related to water. This will be this is related to water, and I would say how how okay. I agree. Other person also agree, but how you will say what whenever we see in our society in some places water is collected automatically, not through person. Is collect water is collect in our society at many places. And for long time, that water will collect for a long time. Then comes types of disease. What diarrhea? This diarrhea comes through when water is collected in any place, at any place. Then comes waterborne disease. Health is a state subject and it's matter for compulsory of government. It's a compulsory matter for our government. And here are also saying health is a state subject for all government. And before that, I said you what it's not our matter of our country. It's matter of all country at global level, at global country. Okay, and this word W T O WHO World Health Organization. This is so what at global level about health, and we will discuss about WHO World Health Organization. So let's see next to we are moving to further fundamental rights and about fundamental rights about health. We are not talking about only health, okay, and you already have heard this word, but we are going talking about and we are talking about related to our constitutions, related to fundamental rights, okay, related to at a global level, related to from other countries also. Fundamental rights about health, okay, means here are telling us in your Indian constitutions are mentioned about fundamental rights about health, related to health. But what are mentioned? Okay, what are mentioned related to health in the matter of fundamental rights? Article 21 of the Constitution of India. Okay, okay, and Article 21. Article 21 grants a fundamental right to life. Okay, personal liberty. Means here are saying Article 21 allows us what you can survive. You can survive your life in better situations. Okay. No one person's can stop you. No one person. Okay. You will responsibility what your health. Your health you will responsibility. Okay. So uh, Article 21 fundamental right to life, liberty, personal liberty. Okay, you cannot depend on other person. Okay. Also, according to WHO, there are coming WHO World Health Organization, and I shared you what when WHO topic will come, then we will discuss, and also here came it recognizes, it identifies health is a fundamental human right. And you are saying what? Not here are saying fundamental right. Fundamental right. Here are saying fundamental human rights. Because in the back multiple lectures we have already discussed about fundamental rights. And in the multiple lectures, we said what fundamental right is of our human. What I'm saying? Human rights, human have fundamental rights, and this right is only for women. Okay, means fundamental rights. So here are saying if according to as per WHO, it tells us what it is says. It says it is not only rights, it is also fundamental rights, human rights, and Article 21. In the Article 21 are mentioned. It grants a fundamental right to life and Through this word, you can understand it's our fundamental human rights. Fundamental right to life and personal liberty. Okay. And according to WH, not according to our government, not according to our Indian constitutions. Here are saying at global level, WHO, it identifies, it tells us health is not only fundamental right, health is also fundamental human rights. Okay. And it shows us what it shows us this is fundamental for only human. Without human who are following our Indian constitution. Okay. And about fundamental right, we will discuss when topic fundamental right will come. Then in deeply we will discuss. Okay. So here are as per here are saying as here are saying fundamental right, uh, human rights according to WHO. Okay, health infrastructure in the country, in the any country, in the any country, no matter only our country, in any country, because if we talk about health, then it may be in any country. Health infrastructure, it's also infrastructure. If health infrastructure will be development in a better situation, will be better, then we can say health infrastructure is nice in any country. Health infrastructure in the country is better in urban areas. And are why are this not saying in urban areas? Why? Why here are saying only in urban areas? And you are notice what here are not saying because facilities of hospitals, facilities of medicine will be available in urban areas, not in rural areas, not in rural areas. And you will see in your society if you live in village area, then you will see what available lack of medical. You will see in your village area lack of medicine, lack of hospital, lack of health services. Then how we can say health infrastructure is better in our rural areas? How we can say? How we can say health is better in rural areas? And now you are clear. We cannot say in our areas health is better situation. Health is better in our rural areas. Okay, and here are why only saying here are saying only why in urban areas because of facilities of medicine, facilities of hospitals. It's available in urban areas. Okay. Okay. Next, healthcare in India. Healthcare in India, and here are not saying at global level because we live in we live in India. So what are condition, what are situation of healthcare in India, and it's suitable to study what are condition health services in India. So let's see. We need appropriate health care facilities. Yeah, it's a compulsory. It's a need. It's a basic need, such as health, such as health, health centers. It's basic needs. Okay, hospitals, ambulance services, blood banks, health insurance, and medical tourism. What is medical tourism? Okay, blood banks. You already know what blood. When we need blood, okay, when we need blood for patient. Okay, for patient, then when then we say what, blood banks. But not only this, we can say what, where are available blood, where are available blood, and we we can get blood from blood bank, and it's available in hospital. Okay, so where are available blood and we can get blood, then we can say that is blood banks. Okay, ambulance services means you often will see services of ambulance. Okay, hospital, okay, health centers, and you will see what health centers are multiple in our India. Okay, but here what is coming, what, medical tourism. Medical tourism is what? Okay, we will say these facilities can provide the care, yeah, and service, yeah, okay, okay. Care means ambulance services, it's care. Okay, hospitals, what is? It's here. But here also services. Services also. Services when we can say, when we can say, when we can say, when when are provided, when hospital are provided us services related to health, then we say what, services. Okay, that a patient need, yeah, already we said, I said what, it's basic need for hospital and also patient. Okay, we also need medicines, yeah, and equipment, material of doctor. Okay, material of doctor for patient. We also need medicines. Without medicine, we can say health hospital is incomplete in your matter. That are necessary for treating patient. Okay, it's a basic need, and it required in our hospital. Without these services and care, we can say hospital is incomplete. And here are what say that are necessary for treating patient. Medical tourism. And I said what medical tourism will come, then we will discuss. Medical tourism is when a person travels to another country. But what for? What for travel? We we can also say what, tourism. Tourism. But when tourism joined, when joined with tourism, what, medical, then we can say what, for medical care, for medical care. Our doctor travel for travel one country to another country for purpose medical care. When doctor need some medicines, some equipment, then also our doctor can travel one country to another country. Then they need, then they require medicine. Okay, and also when in our country are living our citizen. Okay, citizen, and citizen required medicine. Then also that person can go one country to another. What for? For medical, related to services of health. Okay, this was about what is health, what meaning. Apart from this is what fundamental rights related to health. Okay, Article 21 of the Constitution is related to health, healthcare in India, medical tourism. In short, we will see health means our capacity to remain illness. How we can capacity, how we can survive in our age, in our at the present time with illness and injuries, because it's normal in our life, come and go, in our life come and go, but illness come and go, injuries come and go. It's a normal issue. Apart from this, there are other factors that affect on our health. What are other factors? Dullness, inactiveness, laziness, anxiety, being scared. About it, we'll discuss. Okay, for long time. If being scared for long time, then this effect on our health. Diarrhea is what? Diarrhea is a waterborne. When related to water disease produce a disease, then we can say waterborne disease. That is waterborne disease. Health is a state subject for all government, whether they are our government and in another government of country. Okay, no matter. Health is subject, state subject for all country of government. Fundamental right about health. Article 21 of the Indian Constitution tells us grantee a fundamental right to life and personal liberty. Okay. We can survive in better situations because the Article 21 the allows you can survive, you can care your own health. Okay. And according to WH, it identifies, it tells us also what health is a fundamental human right. Okay. And here I am not saying only fundamental right, also fundamental human rights. Okay, health infrastructure in the country and its infrastructure. Okay, you do notice, you do remember what when we will talk about infrastructure, then health infrastructure is will be also included. Okay, when we will discuss related to health infrastructure, and infrastructure of health will be included in health infrastructure matter of health infrastructure. Okay, so without health infrastructure, we can say our country is not suitable in your own ways. Okay. Other words, we say what without health care, we can say what are situation of our country, and other country estimates what are situation of India country. Okay, guess. Okay, other country. So we can say we are depend on health infrastructure. Without health, we cannot survive. Without better health, we cannot survive in better situation. Health infrastructure in the country is better in urban areas, because in rural areas almost we see what it's not available in our village area. If your any friend live in your village area, then your friend will ask you can ask from your friends what are situation of your village in the matter of health services. Then your friend will say what? Your friend will say, in our areas not facility of health services is not available easily, because our area is rural village. Okay, so in the matter in rural areas, we almost see lack of medicine, lack of hospital, lack of what services of health for patient, because it's need for patient. Okay, in urban in rural areas, and it's we only can say health infrastructure in the country is better in urban areas, only in urban areas. If we talk about in rural areas, then we can say health infrastructure is not better in rural areas. Health care in India. Okay, we need appreciate health. We need basic needs. What? Healthcare facilities such as health centers and health center. You will see multiples are available health centers in our country. Okay, hospitals also, ambulance services and blood bank. What is blood bank? Where Already clear? We are already clear. Health insurance and medical tourism. These facilities can provide the care and also services that a patient needs. It's basic needs. So we also need medicine. Yeah. Without medicine, we can say our hospital is incomplete, and equipment also it's need for patient that are necessary for treating it. Medical tourism. When one people travel one country to another country for purpose medical care, and in the most cases we will see what in the matter of medical tourism. Almost our doctor travel travel one country to another country for purpose medicine, for purpose medical care. Okay, so in next term we will see it's half, and we will see in the next term what will come we will see. To next we are moving public and private health care services. Public health care services one side, and private health care services second side. And what are the difference between to this public and private? What are difference? Means what are able in public services and other side private services. Okay, let's see. We will see the public health services is a chain of health centers. Yes, this you will see. What chain of health services? Suppose you are living where? And district. At a district you will see what available of hospital, but public hospital. Okay, government hospital. That is hospital of government. Okay, so at district level is available of public health, government health of hospital of government. Okay, at a district level is available, and you will move and you will go uh, in another district. Okay, in another district, then also you will see what will be available, what hospital of government. And also from that area you will remove in another place. Okay, means at in another district, then you will see what is available, will be available of government public. Means I am telling you, I am saying you what it's a chain of hospital of government. Okay, it's a chain, and it's a chain tells us what are facilities. Okay, what are facilities according to our government. The public health services is a chain health centers, and here what is saying health centers. One district is here. Here is available hospital center of government, and one person will move from this and will go where? This place. Means a district. This area will be urban area. Okay, urban area. So here also will be what? A level of health. Okay, means is here is health centers, and you will get what? Health centers of public government. And so as well as at third place, district place, you will also find center of public government. Okay, so like this you will see what? Center of public government, and it's a chain of health centers of a public government. And hospitals run by the government. Yeah, if this public health centers is health center are government, then also government this run, okay, this will run, okay, they are linked, means these are linked together, okay, okay, these are linked together so that these cover both rural and urban areas. And you are saying resolve of problems, what was problem, our problem was public health services is was available in only in urban areas, not in rural areas. But here are saying if these public center will linked together, then this public center can address, can resolve, can cover also both rural and urban areas. When if these public center will linked together each other, then this can cover both area means rural and urban. And in our country, in any country, two area, rural and urban. Okay. So here are you saying what resolve of a problem. Okay, addresses the challenges. And at the village level, okay, okay, we will see, we see what level, okay, in urban areas, also in rural areas. At the village level, okay, we are saying at the village level first, and in this area comes a issue, comes a problems, raise conflict related to health. At the village level, there are health centers where there is a nurse, okay, and a village health worker. And you are also saying, here are saying, according to this sentence, we can say in the village level are not facilities at high level. Okay, high level. There are health centers. Only is available a nurse. Only is available health worker, village health worker. Here are what saying? Here, what are saying? Village health worker. And you will see in urban areas what? Doctor comes from other country, from big town for urban areas. But here are saying village health worker is available in rural areas, in village level, in village area. And also you can say this means this nurse, okay, nurse will come from urban areas, and from big town country comes in urban areas. Then we are saying this nurse will come urban area, okay, from urban area. PHC full form is primary health care center. Primary health center means first health service. Such a center covers many villages in a rural areas. Okay, we are agree. If this public center will link it together, then this public center can cover many villages in a rural areas, and we need this linked together. Okay, at the district level, okay, we saw at the village level, and we are saying at the district level. Okay, at the district level there is a district hospitals. Okay, and we discuss here. You are saying at the district level, and second is also located at the district level. Okay, so here are saying there is a district level that supervise all the health centers. Okay, means here are saying if health public health care services will enable at the district level, then it's better, it will be better, okay, it will be better. Large cities, because You can say, in other words, what around district level, around people of district level, people can come for treatment of your health, of your relation, people of your area. Okay, so around people around the district level, okay, people come for treatment, for medicine, for anything but related to health services. Okay, large cities have many government hospital. Yeah, because here are saying not a small cities. If here say a small cities, then maybe mention what in a small areas, at a small areas have not many government hospital. Opposite, maybe opposite. But here are saying large cities have many government facilities. Yeah, we agree. If in large cities, large cities will not will not many will not have many government, then where will be these facilities, this government hospitals? Okay, so it's compulsory. Okay, okay, but also compulsory, it's compulsory, means hospital, government hospital is compulsory in a rural areas, in village level. Okay, in a small areas we only not can say what this have many, means this will available in only a small areas, like this we cannot say. Okay, other side, private health care services. Okay, we saw about public health services, and we are saying other side. One side was what public health services, and the second side is private health care services. Okay, so here are mentioned in private health has increased level. Yeah, yeah, it's compulsory for every citizen, for every person, for each patient. Okay, but it's not our problem. Our problem is what you will see. What service is high. Okay, okay. It's not our problem. Okay, our problem is this medical expenses. When point comes expensive in any matter, then we can say people of rural areas cannot afford in the matter of expensive. But here is what medical expensive, and you will see medical is expensive at a very high level. Okay, so according to this, we say what from which many are middle class family. In India country, you will find most middle class family. Okay, so these people cannot afford. So through this difference, we can see what medical class family cannot afford this medical expensive, then this family, this middle class people go in public health care services and treatment, for treatment. Okay, so you can say difference between. Okay, it's not our problem, it's compulsory for quality treatment, for quality, in matter of quality treatment, but it's our problem. And many medical class family are in our Indian country, and this middle class family cannot afford health. Okay, okay, and so we will see, already we saw, but we will see what we have learned. Okay, from this discussion, starting to end, from starting to end. Okay, first we was word is health. Health means already about health we have heard this word, but here are mentioned about health, but in other words, means capacity of our health, what are capacity to remain illness, seek favor. Okay, suppose you are eating junk food, then after some times your body will not work in better condition. Okay, after some times, not suddenly. And if you eat fast food, diet food, then automatically your body will fit, will be fit. So any doctor suggest you what you you should not eat junk food. You must eat fast food, means diet food. Okay, diet food. And health, about it here are mentioned. What are capacity of your health? If your health is not fit, then we can say you are not fit. Okay, okay, you are not fit. But we also can say you are eating junk food, you are not care, you are not getting care your body. Therefore this is reason you are getting sick. Okay, you are getting sick, you are getting fever, your body is not fit. Why? For any reason, from any reason. Okay, so health. Okay, apart from, and you will see many diseases, you will face from many disease, you will face from many disease. But here are saying we saw apart from disease many other factors, from that, from which, from that we we will face, we can face from other factors. What are other factors? You are saying what are other factors? Other factor is dullness, inactiveness. Inactiveness means laziness. When you live you, when you live in lazy, then comes, then can affect on your body. Okay, okay. Lazy, inactiveness, and other, and also the other waterborne. Okay, waterborne. And being a scared. Being a scared is what? When your parents, when any person scold you, then if you are being a scared for long time, what I am saying, for long time, then then comes, then can affect on our body. Okay, so this is our normal issue. It come and it will go from our life. Okay, but we will face from this disease. And I would say compulsory to live in a better situation. So compulsory is what? Compulsory is not junk food, compulsory is fast food, diet food. You will be fit. Okay, because without health we cannot survive in better situation and at the present time. Okay, article 21 fundamental right related to health. So what does it say, article 21 related to health? It says article 21 grants us, allows us what? To life, to liberty, personal liberty. You can survive in better situations. So this is responsibility your, this is your responsibility. You can, if you want to live in better situation, in better fit, then this is your responsibility. Okay, so it says anybody no can say you, no can say you, you means unnecessary point. Okay, an unnecessary point. You can understand what I was saying. Unnecessary, unnecessary point. Nobody can say you, nobody can say you. This is not compulsory for you. So this should not do you. No any persons can say. Okay, article 21, you are clear. Okay, let's see next fundamental. Fundamental. Fundamental means human. And according to WHO, World Health Organization, according to WHO, this tells us it's not only right, it's not only fundamental right, it's your fundamental human rights. And already we have discussed in back in previous multiple lectures what we have seen. We have seen related to fundamental rights, and discuss we discuss what we discuss fundamental right is this the means it's fundamental right for only human. And here are saying what according to WHO, it tells us it's not only fundamental rights, it's your fundamental human rights. Okay, so clear here, till here we are clear. Healthcare in India, what are facilities, what are healthcare in India? Our basic need is what our basic need: hospital centers, ambulance services, blood banks where are available blood, and from that shop we can take for patient. Okay, then we say that is blood bank. Medical tourism, do you know? Now you can explain after this complete lecture. We can say, in other words, in your word also, in your word you can say medical tourism whenever one person remove, okay, one person travel, or any person travel one place to another place for purpose of medical care, of medicine, then we can say that is medical tourism. Tourism is what? When any persons can travel, no, when any person travel one place to one country to another country, then we say tourism. But in the case of medical tourism, then we then we would join word is what? Medical means. So any doctor will travel one country to another country for purpose medical care, medical services related to health services, then we say that is medical tourism. So here we are clear. And then came public and private healthcare services. One side public, second side private. And what are difference between this? Difference is what? Public health services is a chain of health centers. It's not because it's own. It's a private health is your, okay, and it are linked together. So through this, our government can cover both area. Both area means rural and urban areas. Okay. So at the village level, where is a nurse, you will see available of nurse and village health worker only at the village level. PHC full name is primary health care center. Such a center covers many village in rural areas. Okay. Such a center means chain of health centers. Okay. At the district level, there is a district hospital that supervises. Okay. People around the district area, that people can come for treatment of your relation. Okay. Any person, but that person uh, live surrounding your district level there. Okay. Large cities have many government. Yeah. In bigger city have many government hospital are available. Other side private healthcare, you will see difference. Okay. In private health has increased a lot. Okay. Here does not come our problem. It's not our problem. Service side, it's compulsory for every patient. Medical expenses, when comes This point, medical expenses. Then our problem creates expensive. This expensive medical class family cannot afford. So this family, this medical family goes in public center for treatment. Okay, this was about healthcare. Role of a government. What are role of a government in healthcare at global level and also in our country? No matter who our country, because health is a subject for all government of a country. Okay, so this was that's it.